Hey everyone, so right here what I'm starting off with is just introducing myself to the patient. I start off with my name and introducing myself as the student physical therapist assistant. I then ask for confirmation of the right patient, so I ask for his first and last name and then his birthday. And then I go into whether or not he's having pain today. And he stated he's having a little bit of pain on his left shoulder, which he points to right here. Once locating the affected area, I asked him for any contraindications or precautions, such as any recent surgeries he's had, osteoporosis, or any skin conditions that he has, such as like irritation or redness. After getting this information, I move on to testing his growth strength movement in his affected left shoulder. So I show him passively the movement that we're going to be doing, which is flexion of the shoulder. So I raise his arm, and then I have him do it himself, which marks him as already a 3 on the numeric muscle grading system. Continuing with the growth strength test, I ask him to keep his shoulder at a flexion of 90 degrees. I then tell him I'm going to be putting pressure at his wrist, going downwards, and he'll have to resist as much as possible. So I'm going to teleport to the other side and perform the test and see what he ranks. So with min mod max, it seems he ranks a 5 out of 5. Next with my patient, I'll be going over his range of motion of his affected shoulder. So I start with asking him to lay in a supine with his knees bent. I also ask him to keep his elbows fully extended, and here I'm going to show him passively the movement that I want him to perform. After showing him, I have him relax again, and then I ask him if he could actively do it himself. I then grab my goniometer. The fulcrum is going to be at the lateral aspect of the greater tubercle. Stationary arm is going to be at the parallel to the mid-axillary line of the thorax, and the movable arm is going to be lined up with the lateral midline of the humerus of the extremity. I ask the patient to perform the movement again for me himself, moving the fulcrum following the greater tubercle. I then use the movable arm to measure how many degrees of flexion he actually has in his affected shoulder. So his range of motion measured at 168 degrees, which is within the functional range of 165 to 170, the normal range being between 0 to 180 degrees. I then move on to the next test, which is testing his muscle length of the pectoralis major, the sternal fibers. So I kept him in supine position, abducting the shoulder to 90 degrees, keeping his shoulder externally rotated and his elbow extended. After passively showing him the movement, I asked him to scoot over a bit on the table just so I could have his elbow right above the table when I measure. I have the patient perform the movement again, and then I grab my tape measure and measure from the lateral epicondyle to the table. So Hector measured at 1 centimeter from the table to his lateral epicondyle. After testing his affected left side, I wanted to compare the two with his non-affected right side and see if there were any abnormalities within those. So here I have him perform the movement again for me, measuring his, again, lateral epicondyle to the table, in which his right side measured at a 0.7 with his left side at a 1.0 from the table. Next, I'll be doing a manual muscle test on Hector's middle traps. So I ask him to switch to a prone position with his head rotated to the contralateral side. Usually I would keep his head at the same side of the table, but for video purposes, I had him lay the opposite way he was laying. So here I'll be showing him the movement passively. I'll be abducting his shoulder about 90 degrees and keeping it externally rotated. His elbow will be fully extended, and I'll have his scapula retracted. I then have Hector do the movement actively himself. This marks him as a 3 out of 5 already on the manual muscle testing grade. Next, I let him know that I'm going to be applying minimum, moderate, and maximum pressure to his affected side. And then he'll have to resist me going down as much as he can. So I perform it here, min, mod, max, and it seems he ranks a 5 out of 5. Next, we'll be doing a manual muscle test for his anterior and middle deltoids. So I asked him to move to a seated position for me, as it's easier to measure the delts in the seated position. So first I'm going to start with the anterior deltoid. I show him passively how to place his affected shoulder. It's in a 90-degree abduction with slight flexion and slight external rotation. The elbow will also be flexed to 90 degrees. I then ask Hector to perform the movement actively himself, which then marks him as a 3 on the manual muscle testing grade. I let Hector know again that I'll be putting a downwards force onto his affected side, and he'll have to resist as much as he can. So right here I'm doing a minimum, moderate, and maximum force again, and he was able to withstand all of them, which marks him as a 5 out of 5. We go straight into testing his middle deltoid. I show him the movement passively with his elbow flexed to 90 degrees and his shoulder in a 90-degree abduction. I let him know again that I'm going to be applying a downward pressure on his affected side. I'll be putting my free hand as a stabilizer on his contralateral shoulder. I then push down with a minimum, moderate, and maximum pressure. He then ranks a 5 out of 5. Last but not least, I'll be doing a special test to test his supraspinatus muscle. This test is called the empty can test. I'll be putting his shoulder in a 90 degrees abduction with his thumb pointing downwards, acting like he's emptying out a can. I put a downward pressure at his wrist, letting him know to notify me if he feels any pain in his left shoulder. And that's it.